Health leaders given the latest on the rollout of the COVID-19 vaccine in our state. Let's listen in.
We are at or above 25,200,000 cases, which is a further increase of 170,000 from yesterday, and over 421,000 deaths in the United States, another day of 2,000 plus deaths. Here in Minnesota, we reported 727 new cases on a testing volume of just under 11,000. This brings us to a new cumulative total of 456,490 Minnesota cases since the start of the pandemic. This 727 case day is our lowest in a while. Last time we had a number this low was September 29th. And so that's reflects how far we came up and down since the end of September. The weekly change in cases is 1.8%, which is down a bit from the week prior. Testing rates are fairly stable. The 7-day rolling average test positivity rate remains at 5.1%. As you know, our public health laboratory detected the first confirmed United States case of the so-called Brazil P1 variant of the SARS-CoV-2 virus, and several more cases of the UK variant, B117. Dr. Linfield will tell you more about these findings in just a moment. Minnesota reported another 8 COVID-19 deaths today, for a new total of 6,106 total Minnesotans lost to COVID-19 since the start of the pandemic. The hospital bed situation continues to be stable, with the number of beds in use for COVID-19 specifically continuing to drop a little bit day by day. There are currently 496 people in Minnesota hospitals treated for COVID-19. Of those, 100 are in intensive care. A little over 353,000 total vaccine doses have now been administered to Minnesotans at last report, as shown on the state's dashboard. To be clear, this 353,000 represents both first and second doses given. As you see on the CDC's tracking site, it shows that over 690,000 total doses have been shipped to Minnesota. But as we talked about before, this includes doses that are shipped specifically and held aside for the CDC Pharmacy Partnership Program to vaccinate in long-term care, as well as doses shipped to Minnesota providers. So when we factor out the almost 220,000 doses set aside for that federal program and the just over 243,000 that are set aside for second doses, as well as taking into account the doses that are actually still in transit or just arrived in Minnesota within the last day or so, it's more like 326,000 first doses that have actually been available for vaccine providers to use to give shots. So that puts I hope the numbers in a little bit clearer context. I realize that's a lot of numbers to keep track of, and there are many layers to these reported doses allocated, shipped, received, and delivered. We hope to just keep getting clearer and clearer about that for Minnesotans. With that, I'll ask Dr. Linfield to talk some more about the new variant that we've discovered in Minnesota.
Thank you, Commissioner. Yesterday afternoon, we announced that our public health laboratory had found the variant of the SARS-CoV-2 virus known as the Brazil P1 variant in a specimen from a Minnesota resident with recent travel history to Brazil. This case marks the first documented instance of the Brazil P1 variant in the United States. While this variant is thought to be more transmissible than the initial strain of the virus that causes COVID-19 disease, it is not clear yet whether the variant causes more severe disease. The variant was found through the MDH's variant surveillance program. Each week, this program collects random samples from testing partners and then conduct special testing using whole genome sequencing. Through this program, the state develops a more accurate picture of what specific forms of COVID-19 are circulating in Minnesota. This new finding underscores the importance of COVID-19 testing, as well as continued efforts by all of us to limit the spread of the virus. The virus continues to evolve, as all viruses do when they replicate in people. So that is another reason why it is extremely important to limit COVID-19 transmission. The fewer people who are infected with this virus, the fewer the opportunities that the virus has to evolve. The good news is that we can slow the spread of this variant and all SARS-CoV-2 variants by using the tried and true prevention methods of wearing masks, keeping social distance, staying home when sick, and getting tested when appropriate. The patient with the Brazil P1 variant is a resident of the Twin Cities metro area. The person became ill during the first week of January, and the specimen was collected on January 9th. The patient spoke with MDH case investigators after the initial test came back positive for COVID-19 and reported traveling to Brazil prior to becoming ill. We have been re-interviewing the person to obtain more details about the illness, travel, and contacts. We are the first state to find this variant, but that doesn't necessarily mean Minnesota is the only state to have this variant circulating. We are fortunate to have one of the best public health laboratory surveillance systems in the United States, which gives us stronger insight into what these viruses are doing in our state. Yesterday, we also reported that our public health laboratory had found two additional cases of the UK variant through surveillance testing. Of the two new cases, which are laboratory detected, both are Twin Cities metro residents, and both reported recent travel to California. Yesterday, CDC told us they had found an additional Minnesota patient with this variant through their surveillance. The patient is also a metro area resident, and this patient had recent travel to the Dominican Republic. With these latest cases, there are a total of 8 UK variant cases which have been identified in Minnesota, although more are suspected to exist. These cases show why it is important to limit travel during a pandemic. We know some people have circumstances where they really need to travel. If that is the case, it is important to watch for symptoms of COVID-19, follow public health guidance on getting tested prior to travel, use careful protective measures during travel, and quarantine and get tested after travel. For passengers traveling to the United States from abroad, a negative test from within 3 days of travel or a certificate of prior infection will be required to board the plane beginning today. Travelers are recommended to test for COVID-19 3 to 5 days after they arrive in the United States and to quarantine for at least 7 days. It is also recommended that they keep away from individuals who are at high risk of severe disease for 14 days. Regarding domestic travel, it is recommended that people consider getting tested 1 to 3 days prior to the domestic travel, and that they restrict their activities for at least 7 days upon return, and that they get tested for COVID-19 3 to 5 days after arrival. We really strongly recommend that they get tested. You can see that most of our cases that have been identified as having a variant strain have been travelers. Widespread testing is an important tool that we need to continue to use for tracking what COVID-19 is doing in Minnesota. Broad testing is also the best way to find asymptomatic or pre-symptomatic cases, which we know can still spread the virus to others. And we really encourage people to test. We have a lot of testing capacity in the state, and especially individuals who have frequent contact